Presidensi G20 Indonesia akan diselenggarakan pada bulan November mendatang. KTT G20 akan berfokus pada 3 pilar prioritas, yaitu arsitektur kesehatan global, transformasi digital, dan transisi energi. Dengan tema Recover Together, Recover Stronger, KTT G20 tentu saja diharapkan dapat mengambil langkah nyata untuk mengatasi berbagai isu, termasuk dampak disrupsi pandemi pada anak-anak. Lalu seperti apa upaya yang dilakukan untuk memprioritaskan kepentingan anak pada agenda G20? Insight akan membahasnya lebih dalam kali ini bersama saya, Desi Anwar.
Pandemi COVID-19 telah mendisrupsi dan mengganggu pendidikan secara global. Hal ini jelas berdampak terhadap ratusan juta anak di dunia. Perubahan mendasar dalam sistem pendidikan dan menjadikan pembelajaran semakin relevan dengan tantangan di abad ke-21 harus dilakukan semua pihak guna menjawab tantangan global. Tidak hanya di sektor pendidikan, isu kesehatan dan lingkungan pun perlu diperhatikan guna mencetak anak-anak yang tangguh dalam menghadapi tantangan di masa depan. Momentum presidensi G20 Indonesia pun diharap dapat mengambil langkah nyata untuk mengatasi berbagai dampak persoalan yang menempatkan anak-anak dan anak muda pada risiko tinggi. Demi mewujudkan masa depan yang lebih adil, tangguh, dan berkelanjutan. Karena kesejahteraan dan kemakmuran masa depan bergantung pada anak-anak.
Bertepatan dengan bulan peringatan Hari Anak Nasional pada tanggal 23 Juli, delegasi muda dari seluruh dunia termasuk Indonesia akan berkumpul di acara final Y20 Youth Summit, di mana mereka menyelesaikan serangkaian rekomendasinya untuk diajukan ke agenda G20. Selain itu, pertemuan tingkat Menteri Pendidikan pun akan digelar guna berbagi perspektif tentang prioritas pendidikan, terlebih usai dihantam disrupsi pandemi. Lalu bagaimana forum global G20 dapat berkontribusi dalam solution finding untuk isu-isu krusial, khususnya bagi anak-anak? Sudah ada bersama saya di studio Acting Representative UNICEF Indonesia, Robert Gas. Hi, Robert.
Hi, Desi.
Welcome to the studio.
Thank you very much. It's very nice to be here.
Yes, and thanks for joining us. And I think this is going to be a very important conversation because in July, on the 23rd of July, Indonesia celebrates the National Children's Day. And of course, Indonesia has the current G20 presidency, and some of the issues that we will touch on, hopefully, are issues of concern to children. Now, UNICEF itself, of course, has been in Indonesia for over 7 decades, if I'm not mistaken, right? Helping the Indonesian government, Indonesian people with support and ensuring that Indonesian children grow up happy, healthy, with all the rights and the access that they need, particularly towards education and their health. Now, just as, because we haven't really spoken much with UNICEF these days, just tell us a little bit, how is Indonesia doing over the years when it comes to, our policies and the way that we actually ensure that our children grow up healthy and with all their rights fulfilled? Are we on the right track? So what are the, positive things you can tell us that's been happening?
Great, Desi. Thanks very much for having me here. It's really great to be here, and very nice to be able to talk a little bit about Indonesia and UNICEF's involvement in Indonesia over the past 7 decades, as you've mentioned. We've had a long history, and the context of our work in Indonesia has evolved over time. We are very actively involved in various different areas related to child rights. I think, as you know, the core convention with which we work in UNICEF globally is the Convention on the Rights of the Child. And within that convention is basically an agreement that is signed by almost every government globally, including Indonesia, that defines the rights for children and Indonesia's role and the role of all governments to support that. So we've been working in areas related to health, issues related to make sure that children get a good start to life, getting vaccinated, also that mothers get good antenatal care and postnatal care, also as it moves through the life cycle in areas related to nutrition. Again, there's been significant issues related to stunting and wasting, which the government of Indonesia has taken a big role on, education, and various other areas as well. Many of these areas, I think Indonesia has made tremendous progress over time and has really been able to reduce rates of childhood mortality, maternal mortality, issues even related to stunting. I think this has been a priority for the government of Indonesia, a priority that has been identified to be addressed by all of the different ministries. And there's been significant progress that's been made in that area as well. Still, there are challenges,
yes,
and
sure.
those challenges.
There are plenty of challenges.
There are indeed. Challenges related to education, challenges related to certain areas still not being fully vaccinated, challenges related to nutritional issues as well. But I feel that the government is very committed to that. The government has taken on many of the different targets and indicators that are included in the Sustainable Development Goals and has really taken those on as their own. One of the pieces that I think has been really inspiring for us and is to see the government of Indonesia's leadership in high-level events, the high-level political forums which take place during the General Assembly in New York, where Indonesia was actually the first to translate the Sustainable Development Goals and their operational roadmap with a child-focused lens. And for us, that was something that was instilled a lot of pride. It was something that we had vice presidents and others come from various other countries to participate on this particular event that was led by Indonesia, and to see that the Sustainable Development Goals are not just something for adults, but they're for something that are important for children as well. Yes,
absolutely. And children, basically the future of the country. We have, healthy, happy children, and we can ensure a good future for Indonesia. But, Indonesia is not like the other Southeast Asian countries. Obviously, we're a country with over 275 million people, over 80 million of them are children, obviously, and the archipelagic state of our countries makes it very, very difficult. I mean, particularly in terms of the challenges in coming up with, the right support for the different areas, and also just managing, the kind of programs that you work with. How does it work, basically? I mean, how closely do you work with not just the central government, but also the local governments, and ensuring that the right needs are met in the different areas, Robert? Because I would imagine it's quite tricky for a country like Indonesia.
It is. And I think one of the ways that UNICEF works is that we really want to make sure that when we define programs of cooperation with government, and our principal partner is the government of Indonesia, as it is in every country, we start with a situational analysis of children to really understand sort of where there's been areas of progress, where there remain to be challenges, and where is our comparative advantage? Because we know that there are certain areas where we can do better, and we know that there are other areas where other organizations can work more effectively. So we do that. We work with Bappenas principally as our main government partner, but we also work with another 17 line ministries across Indonesia that stretch across health, Public Works, Ministry of Education, Social Affairs, all of these different ones, and even ranging to some areas you may not think about in terms of forestry. And we work with them to define what are the areas of cooperation in which we work. To be able to be effective, we work at national level, and so we work directly with line ministries and try to cooperate in defining policies that are more favorable to children. But we also work subnationally, and we have 7 field offices that stretch... 7 field offices.
But altogether, how many UNICEF staff are there, both local and...
We have about 170 regular staff, but we have about another 170 on top of that who are consultants or United Nations volunteers. We have some fabulous United Nations volunteers that come from Indonesia. So for a total of about 340 staff altogether that are placed in all of these different offices.
UNICEF, which is United Nations Children's Fund, I mean, is there a difference over the years when it comes to the amount of fund allocated, particularly to Indonesia, and how does the United Nations basically allocate these funds based on what? Is it
Basically, these funds are not really allocated by the United Nations per se. These are funds that come from different governments. We also have funds that are raised here in Indonesia. We have over 50,000 pledge donors here in Indonesia who contribute on a regular basis because they're concerned about child
individual
rights.
donors?
Individual donors. And we also have various different corporations who also want to partner with us. So we get contributions from various governments across the world. We also get a lot of contributions from organizations and from individuals here in Indonesia.
And so
as
these
well.
funds increase over the years, or do they level off at some point? Just out of curiosity.
A little bit depends. And so for example, right now we've got a situation in Ukraine, and so a lot of resources globally are being targeted there. And the fact that Indonesia is a middle-income country and close to an upper-middle-income country, sometimes resources are a little bit more difficult to attract to places such as this.
Okay, but I hope still enough in order to meet all our needs. Robert, we take a quick little break, but we still have a lot to discuss in this program. Tetaplah bersama kami, Insight with Desi Anwar akan segera kembali. Insight with Desi Anwar, saya ditemani Robert Gas, Acting Representative UNICEF Indonesia. Kita berbicara mengenai Youth 20 di Indonesia dan juga mengenai Hari Anak Nasional nanti yang akan jatuh pada tanggal 23 Juli. Tentu kita fokus terhadap masalah yang dihadapi oleh anak-anak Indonesia itu perlu kita diskusikan. Now, Robert, you've been in Indonesia now 3.5 years as acting representative. Now, this is 2 years of which is obviously the COVID years. And you mentioned the priorities and also the rights of children is one of them is to education. Let's focus on education because during the COVID pandemic, which is, we're still in the middle of it, but hopefully towards the tail end. Education is something that has been really disrupted, particularly for children all over the world, not just in Indonesia, but particularly in Indonesia, where access to education itself is already a challenge. Well, what are your observations about how the government or all of us have handled education, particularly for children who had, at the end of the day, stay at home, do their learning through technology and not being able to go to school, meet their friends? What are the takeaways and lessons learned that we can see from the last couple of years?
Yeah. Well, I think, as you said, education has been significantly impacted. There's been over 500,000 schools that were closed during the COVID pandemic, over 60 million students that were impacted and were not able to go to school on a regular basis. And as a result of this, there was a significant crisis in terms of learning. And we know that not just in Indonesia, but globally, that the education systems were not resilient and not ready and prepared to be able to address a challenge such as this. So one of the significant issues was that there was a significant learning loss, and I think it'll be very difficult to recapture this, and we'll need to focus on that. 2 years is a
long time in a child's life.
Exactly, exactly. In addition, I think even before the COVID pandemic, we had over 4 million children who were out of school, which is a fairly large proportion. We feel that the numbers of children that will fall out of school may increase by another 500,000, taking us very close to 500,000 children who will be out of school, and they will need to be prioritized in terms of bringing them back into school. Many of these children, I think, are at such great risk of falling behind their learning that they may never catch up. And what we're worried about in this is that this may contribute to cycles of poverty, where their children also will not have the same benefits, and it may take another 2 or 3 generations before these children are able to recover. We need to really focus on this. There's been already an alarming deterioration in basic reading skills and basic numeracy skills, skills that Indonesia really will need as it continues to progress and wants to be able to be one of the largest economies globally.
So is this something that UNICEF, I mean, the last couple of years, are you sort of realigning or coming up with new ideas for policies and giving feedback to the government on how best to address this, and also if should there be future pandemics, this kind of situation could be easily mitigated and addressed?
Exactly. I'm not sure about easily mitigated,
well,
but clearly to be mitigated.
There has to be some kind of strategy.
And I think that the government of Indonesia has actually taken a very significant role on that. I think that we've benefited from the Minister of Education, Minister Nadiem, coming from a background focusing on technology and recognizing the importance of being able to use technology to advance various different objectives, including for learning. So that's been one of the key priority areas, is to figure out how we're able to increase access to digital learning for different communities, recognizing that access to the internet and to the web is different in different parts of the country.
Gap. And of course, when school is now dependent on ownership and literacy of these technologies, that's where the gap becomes a lot more pronounced, isn't it?
Exactly, exactly. But I think that one of the things I'm really hoping from COVID is that we identify the opportunities from this as well. And I think that one of the constraints in education here, as in many countries as well, is that much of the education only happened in those hours when the child was at school. There was very little learning that took place at home, and there was very little learning that was taking place through different media, such as through the internet and web. Because of COVID, and where we had to actually transition and use different modalities, where educational materials had to be digitized so that children would be able to learn from school or to be able to learn from the web, provide us with opportunities to actually improve the quality of education as we move forward.
Okay. Can you share with us some of the programs that you're working on education in Indonesia currently?
Sure. Well, we have several programs. One of the key programs that I mentioned is a program on terms of rural education. And these are programs...
Rural education.
Rural education.
When we talk about rural, I mean, outside of Jakarta.
Outside of Jakarta, a lot of it is in Papua, and West Papua. I mean, really where schools tend to be far removed one from the other. Access is limited. Sometimes in terms of teacher attendance is also not necessarily so regular. And focusing on both changing some of the pedagogical approaches to learning, making the materials that students access more contextualized to their own reality, so that when you're having children in Papua who are learning, that they're seeing pictures of other children in their school books that look like Papuans, or that they are eating the foods that are eating this, that are more relevant.
Sensitive to the culture and the areas.
Exactly.
You mentioned we have a Minister of Education who's very technologically savvy. Perhaps you can tell us, in terms of education, it's not just about the children, obviously. It's the curriculum, it's the material, but also the quality of teachers. I mean, with or without the pandemic, we've seen that there are many areas in education that needs to be fixed. And what other things that come to mind when it comes to education, particularly for a country like Indonesia, very diverse and very different in the context of just the learning environment, that going forward, that we should actually implement in those areas?
Well, I think one of the pieces that we focus on is the PISA scores, and that stands for the Program for International Student Achievement, and it's a standardized test.
Always Indonesia, somewhere at the bottom.
Is low, yes, and in areas in terms of numeracy and literacy. So some of the areas that we focus on are trying to build capacities for better approaches to education is one area. A second is to allow for different opportunities for learning. And a third is to really focus on some of the 21st century skills, so that when we're going beyond there, that children who may not choose academic backgrounds but may want to get into different areas but are well prepared for the workforce. That's beneficial to them, and that's beneficial to the country overall, as it will strengthen the economy and allow Indonesia to be more competitive.
Now, access to education obviously is still a problem. You mentioned particularly in the outlying areas where schools are, they're far away, where they're scarce, and teachers are scarce, and also the learning materials not there. Plus, there's no connectivity. What are the things that you think that the government should really focus on when it comes to creating this kind of connectivity and speed up everybody's learning, putting everybody more or less on the same level, which is what technology should be doing, right?
It should, exactly. And I think that that's really one of the key areas is really what you identified, is to expand connectivity, be able to provide access to the internet, provide materials and equipment so that students are able to access it. I don't think we can get to something where every child in every home is going to be able to have access to a computer and be able to access the internet. But if you're able to already bring that into the classroom and have one computer there, being able to access, there's so many educational materials that are available that make learning interesting, that make learning relevant, that make learning something that students want to pursue. And so I think by doing that, we don't need to necessarily go from 0 to 100, but if we can go from 0 to 60 or 0 to 70, we're already making significant progress there. In some places, you'll have children with much more access to computers and to those educational materials. But even if we can get it into the classrooms in some of these other areas and train teachers to be able to use those materials, make them aware of that, I think teachers are all well-intentioned. I think the government is well-intentioned. It's just basically bridging that gap and making people aware of the materials that are there.
I mean, the key is not the intention, right? It's the implementation. Just very quickly, you mentioned about our PISA scores, and we haven't been doing it. It seems to be very, very difficult for us to improve. I mean, is this a fair assessment of what is happening and the quality of Indonesian, young Indonesians' level of education? Or is it because we're such a big, country, and also perhaps the way that the scoring is carried out? I mean, is this something that is of a worry going ahead? Should we really keep focusing on?
I do believe so. Yeah, I think that we do need to continue to focus on education, and I think this has been very clear from the highest levels of government. I think from the president to the ministers of health to all of the others, that we need to really focus on that. And really, education is something that's been identified as young people as their #1 priority. They want to have access to quality education. They want to learn. They want to be able to have skills for the future.
How far behind are we compared to, for example, well, you said you were in Thailand, so countries like Vietnam, which is more or less on the same development path as Indonesia? I feel like we're sort of, stagnant, because when we talk about these PISA scores, it doesn't move very much from.
I don't know all of the scores for all of the different areas. I did live in Thailand before, and the scores there were also not so high. And so I think that there are some issues in terms of different pedagogical approaches, in terms of how teachers teach children. But I do see positivity here, and I think that this is an area of focus. I think that we have a great opportunity after COVID to really strengthen some of these systems for learning and for allowing children to learn more
And you work well with the government, obviously.
We have very, very strong relationships with the government, I think, across all of the different ministries, and they are our main counterpart, and we follow their guidance.
Okay, we take another little break here, Robert. Tetaplah bersama kami, Insight with Desi Anwar akan segera kembali. Masih bersama Insight with Desi Anwar. Topik kita kali ini mengenai bagaimana kita meningkatkan kualitas anak-anak Indonesia. Di studio bersama saya Robert Gas, Acting Representative UNICEF Indonesia. Robert, we talked about education, which is of course very, very important and very challenging in Indonesia. Earlier you mentioned that we need like decades in order to address this problem, but we do agree that education is crucial when it comes to raising our children. Quality education, access to education, affordability, quality of teachers, these are all extremely important. But equally as important, of course, is health issues. And health, I believe, is one of the things that UNICEF focuses on. Again, COVID-19, it's a health disaster for all of us on this planet. It's a strain on our medical system, it's a strain on our health, and particularly it's a strain on the health of our children. Your thoughts, takeaways, lessons learned, what have we, what can we say about the effect of the pandemic on our children in Indonesia?
It's had a very significant impact. I think that the numbers of people who've been affected by COVID here in Indonesia, we've had over 150,000 deaths. We've had over 6 million cases here. And the impacts have been devastating, as you said, is that often it's prevented access to other essential health services for the elderly who have been used to being able to go and see their doctors when they were falling sick or they needed refills or medication, were unable to do so because of risk of COVID or because the health system was overburdened. I think children were significantly impacted, and one of the key areas was in the area of vaccination. Many
general vaccination,
general
right?
vaccination,
immunization,
exactly, immunization. Yes, exactly, immunization. Just the basic immunization.
Can you give us numbers on how it was impacted in terms of?
Sure. I mean, basically, we saw very in terms of basic immunization from the beginning of the pandemic dropped from about 84% to about 79%.
Wow, that's quite significant.
Yes, we saw even larger decreases in terms of antenatal care visits, which are important not just obviously for the mother but for the child. Right? If you're really talking about a child getting a proper start in life, they need to be the mother needs to be receiving good antenatal care. There we saw even a larger drop from 89% in 2019 to 75% in 2021.
In any particular areas? We're talking about
across the country. So yeah, in terms of receiving the complete complement of antenatal care visits, some of them received some, and in postnatal care it was even larger, from 95% to 78%. So very, very significant.
And these would mean what? You know, in the near term or in the longer term future, you know, the reduced amount of vaccination, reduced amount of attention, and you know, postnatal care. Yeah. What would it mean to?
Well, it has many impacts. I mean, in terms of antenatal care visits are a way in terms of making sure that the mother is eating properly and getting the proper nutrients so the child is developing in a healthy manner. I think in terms of immunization is the greatest, one of the greatest inventions that has ever come across this planet and saves hundreds of millions of lives every day. And so when those are delayed, that obviously has significant consequences for that child. Postnatal care as well is often the risks of maternal mortality. If a mother is not able to deliver in a healthcare facility, if there are any kinds of complications that occur that can be treated or handled very easily and quickly in a health facility, that may not be available to her in that context.
Did you see the infant mortality rate going up, particularly in the years of COVID, or?
There has been some. I don't really have the exact data on that, but there have been some increases in that, which is kind of to be expected in this kind of a situation. And again, that's not just a situation here in Indonesia, but globally, because this was a consequence that we found all over. UNICEF worked very closely to try to...
with the health ministry?
With the health ministry. We worked very closely, and all of our work is with the ministries, and we have a very strong relationship with them. But to really work on ways to generate demand and to generate awareness. So one, in terms of the side of COVID, to make sure that preventive health measures were being undertaken to reduce the transmission of COVID, but also to communicate to parents the importance of these well child care visits, that they would continue to get routine growth monitoring, that they would continue to receive the basic immunization set so that they're protected from things that, such as diphtheria or measles or rubella, that are common killers.
Absolutely. I mean, you know, we are a tropical country, so we're prone to all sorts of diseases. Immunization is extremely important. Even without COVID, you know, the acceptance rate I see, it's not even 90%, so there's still that gap which needs to be addressed. Now, you also mentioned that, you know, the lack of pre and also antenatal care and the healthy development of children. Stunting was one of the things that you mentioned that UNICEF is focusing on now. Is the government on the right track doing this? I mean, I know that there has been some reduction when it comes to the percentage of stunting, but if I'm not mistaken, it's now around the 20%, but the government wants to reduce it to around 14% by 2024. But that's just like quite an ambitious target. How best to do it, and what can UNICEF do in order to help reduce the number of stunting cases in Indonesia.
I think I really like to commend, I think, the government of Indonesia for taking this so seriously, because stunting is not just an issue of reduced height, but it basically has impacts in terms of cognitive development, in terms of everything, exactly.
The quality of the child's life and the kind of adult that that child will grow up into.
Exactly. So it is a real priority, and I think that the fact that the Vice President's office has mandated that this become a priority for all ministries, that they integrate and they look in terms of the services they provide, not just in terms of health, not just in terms of public works and quality of water, but across all ministries for them to focus on that. And that's had great dividends, as you pointed out, that there's been a very significant reduction in the rates of stunting overall. Unfortunately, in the period of COVID, some of those have been reversed, and we're starting to see increases in rates of stunting, increases in rates of wasting, and overall levels of malnutrition, even obesity, because many families are unable to afford healthy diets in the context of COVID and end up eating foods that are not so healthy and which generate obesity there. So I think these pieces are taking place, and the government has really led on this. Indonesia has actually been featured in terms of some of their advancers in some of the regional events that have taken place.
Can you give us some examples of the programs that UNICEF particularly have been working together with the government in order to address these issues? Well,
there are programs, for example, in terms of the integrated management of acute malnutrition. And so you really identify acute malnutrition, which is sort of a short-term event, and make sure that it stays a short-term event, and so that it's not something that is continuing on for a long time, which will result in stunting. Stunting is a longer-term event, and is something that is not just happening from 1 week of diarrhea or 2 weeks of not eating the right food.
But it's first 1,000 days of a child's life is something that we need to focus on.
Exactly. So there are programs related to that. There's programs related to ensuring micronutrients are sufficiently absorbed, and so we work with the governments and also with the Ministry of Education to ensure that girls in particular, who are more prone to anemia, are receiving iron supplements while they're in school. So that's another piece.
And also education when it comes to good nutritious food, because this is often also the case, right? Lack of knowledge about what's good for the baby.
And physical activity to make sure that also that you're preventing obesity on the other side, because nutrition really spans that whole spectrum from undernutrition, poor nutrition, and overnutrition.
So do you think we can, or we would be able to achieve that target of reducing stunting to 14% by 2024, considering that, it's only recently that we've had stunting cases of over 30%?
Well, the progress is quite fast, and I'm not the nutrition expert on that, but I do know that we've seen significant and impressive reductions. I think what we'll have to see is not only the fact about being outside of COVID, but within the other effects that are taking place with economic downturns globally and shortages of food, what that's going to mean. So it's a little hard to predict, but I think the government is focused
Absolutely. I think you're absolutely right. It's not just about, nutrition. It's not just about, pre or antenatal care, but it's about the economic condition as a whole, poverty, access to clean water, access to education and to health services. These are all integrated, important in order to raise, healthy children. We'll have another little break.
Okay.
Robert. Jangan kemana-mana dulu, Insight with Desi Anwar akan segera kembali. Anda masih bersama Insight with Desi Anwar. Bersama saya di studio Robert Yas, Acting Representative UNICEF Indonesia. Pada tanggal 23 Juli nanti Indonesia merayakan Hari Anak Nasional, dan tentu saja fokus terhadap kesejahteraan anak-anak itu harus kita lakukan, dan UNICEF adalah partner atau mitra dari pemerintah dan juga negara Indonesia dalam memastikan bahwa anak-anak kita tumbuh berkembang dengan sehat dan memiliki semua hak dan kebutuhan yang mereka perlu dapatkan. Robert, education, health, and now let's move to something that is actually a concern that young people, children have, and have voiced around the world, in particular through one Greta Thunberg. on climate issues, climate crisis, climate change. And I know that the world has been a little bit distracted on these issues due to, again, the pandemic and now the war in the Ukraine, and also all sorts of other issues such as the rising price of fossil fuels and so on. But climate issues and all the horrible things that can happen if we have climate disasters, these are the things that children across the world are worried about. What are your perspectives on this? Because you know, we may not be here tomorrow, but they are the ones that will inherit the planet from us. Of course, this is something that I think all of us, responsible adults, need to also take care.
Exactly, and I think the young people of today are calling on us to act in a more responsible manner, recognizing, as you said, that the future is theirs, and what we're leaving them right now is not the most interesting future in terms of the quality of the environment. I think globally, as you mentioned, it's a significant area of concern, but I think the climate crisis and the corresponding environmental degradation is of significant issue in Indonesia. Indonesia actually ranks 46 out of 180 countries in UNICEF's global children's climate risk, signifying that basically the children here are at high risk of issues that happen to children. We have different types of risks. So we have some kinds of risks that are related to climate and
such as extreme weather changes, for example.
Extreme weather, which will impact children to a greater degree. They're smaller bodies. They're much more susceptible to high heat and issues like that.
And more diseases.
Exactly. Dengue and malaria are going to be more prolific with changing climate, and so that will impact them as well. And that will impact them to a greater degree than it will for adults. And so the climate crisis really is a children's crisis, and it's one that we need to focus on, not just in terms of ensuring that it's a beautiful environment, but one that's safe for children.
But do you see Indonesia as having a good sort of climate policies that will actually address this? I mean, we mentioned, for example, particularly Indonesia being an archipelago, and if the sea level rises, there's going to be a lot of coastal damage, and of course that would impact not just the quality of life as a whole because of more diseases, but it's the quality of our soil, the quality of our water, the quality of our food. Plus, of course, there's going to be a lot of displacement of people, and children in particular are vulnerable. Do you see a readiness when it comes to mitigating and adapting to this kind of situation?
I think we're very early on, and I think that there's a tremendous amount of work to do. I think another piece that to your list as well is air pollution. And air pollution is
now particularly.
Exactly.
I mean, we were saying during COVID, look at the lovely blue sky, but now it's
exactly, and is one of the top 5 killers of children in Indonesia. And so it is something that we need to do. It's not just something that's unpleasant to look at, but it's killing our children. And so that's something that we definitely need to focus on. I think when we look at climate change, it really impacts across all different areas. I think that you articulated several of the areas in terms of health concerns, in terms of increases in dengue and malaria and air pollution and things like that. Also, it'll impact nutrition, and I think one of the concerns is about creating these nutritional wastelands and areas where you might not have nutritious crops being able to grow, which will force more kids to have canned foods, which are more obesogenic, etc. It will impact in terms of families staying together, because more families will no longer be able to farm and stay in their areas and will need to move, which will increase the rates of separation between children and their parents. So really in all of these different areas, there is an impact.
Plus also increased natural disasters. We're already prone to natural, but if there be more fires, more floodings, more drought.
We've seen situations where schools have been closed because of the levels of pollution from burning crops or forest fires that have taken place, and which have shut down schools. And so again, when schools are shut down, kids are not learning. When kids are not learning, basically their futures are impacted, and the overall economy and the health of the nation will be impacted as well.
So your collaboration with the government, who are you working with? And tell us a little bit more of some of the programs that you think are quite, good and that we should know about in order to address some of these challenges.
I think one of the pieces is that we have actually very strong collaboration with the Ministry of Forestry and Environment. This is a new partnership that we have in our current country program, and was just actually at one of the G20 events last Sunday, where we were presenting one of the studies that we're working with Bapenas on, and talking about the co-benefits associated with addressing climate change. So not just in terms of improving health outcomes, but how you can actually improve economic outcomes as well by introducing green technology, which might provide different jobs, but also decreasing costs that the government is having to spend on healthcare, for example. Every child that gets sick, and those costs having to be covered by
it's a burden.
It's a burden. If they're not learning as much because they're sick or other issues, that's impacting the contributions that they're going to make to the future economy. So really trying to present it in a situation where it's not just something that's the right thing to do, but the thing that makes sense to do from an economic perspective as well.
And we will be having the Youth 20 Summit in July.
Yes.
Obviously, I think youth participation is, I'm sure you agree with me, very, very important. Yeah. Policymakers around the world should listen to what it is that the children are telling them, and at least treat climate crisis as the emergency it is. It's not just another topic in the agenda. It's something that will affect us all, and it's already affecting us all. How can you? Are you doing anything in order to encourage more young people in Indonesia to be much more proactive, much more conscious, much more critical on government policies? Is this something that is of interest to UNICEF?
Oh, of tremendous interest, I think, and we're looking at it from various different angles. I'll just mention three different ones. One is that we have an organization called Mitra Muda, and which is a newer initiative, and where we've really identified young people that cross the entire spectrum. They come from all different parts of Indonesia. They're boys, they're girls, they're young men, young women. There are some with disabilities, there are others with different interests, but really represent a cross-section of the large country that Indonesia is. And they've identified different priority areas that they want to focus on. Okay. Climate environment is a big one. We also have adolescent circles where we bring together young people who are participating in co-creation and sort of identifying issues such as child marriage or disaster preparedness or issues related to pollution, and help us identify solutions. We had a great example in NTT where where a lot of women, young girls, were unable to go to school because of having to go collect water, and so were being out. And they actually helped design an approach to getting the water more accessible. And then finally, really working with young people to help them be more informed in terms of informing subnational planning, so that when budgets are made, Indonesia is a very decentralized country administratively and financially. The budgets go down to subnational levels, and having them be participating as decision makers, not just tokenistic people who are talking, but actually participating in the decision making. And
you feel the energy, you feel the young people of Indonesia are actively, they want to be involved.
I think so. And I think you would actually have a much more effective conversation here with a young person than you would with me.
I'm sure, and I think all the G20 leaders would do well to listen to their children instead of creating more problems.
A colleague of mine was at one of their events recently, and she was almost in tears in terms of, she was so moved by the passion, the intelligence, the commitment of these young people. They're really quite inspirational.
Okay, we'll take another little break. We still have one more segment to go, Robert.
Thank you. Let's see.
Jangan kemana-mana dulu, tetaplah bersama Insight with Desi Anwar. Masih bersama Insight with Desi Anwar. Di studio ada Robert Gas, Acting Representative UNICEF Indonesia, and we were discussing about the children of Indonesia. Reminds me of the song. The children are the future, and I think we need to make sure that we give them a good start in life. We give them opportunity. We make sure that they're well educated, that their health is taken care of, and that they grow up in good, stable, healthy, clean environment. These are tall orders, but actually these are all very, very basic needs. Now, Robert, we've covered education, health, the needs for focusing on the climate and the environment. But there's still so many challenges, particularly in Indonesia, where it's not just a matter of poverty, it's not just a matter of access to health and education, but it's also culturally. For example, on issues such as child marriages, which we still see, and girls' education. And I think that's one of the keys for any country to succeed, is when you educate your girls, you basically create a good future for the country. And as well as all the opportunities that should be given to children of both sexes. What are your thoughts on these issues? That can be actually preventable through dialogue, education, and of the parents.
Well, I think gender is critical to all of our programming, and is basically a common thread that we ensure encompasses all of our.
So there is a focus, UNICEF.
We have very much of a definite focus on it, and is one of our, organizationally, one of our core change strategies. And basically saying is that if you're going to bring about change, you have to address the gender dimension. So that is something that we work on completely, and which is why also when we work on issues like with Mitra Muda, when we work on issues related to nutrition, all of these different pieces, we basically look at the gender dimension. And it's not always that the girls who are disadvantaged. I think, when you look at education, actually, in terms of attainment and participation, often it's actually girls who
once they're educated, they're the ones that excel.
Exactly, exactly.
But it's, making sure that they all
that
get
they
the
have
right
access to that. So that is something that we have a key focus on.
And you work together with...
We work with the Ministry of Women's Empowerment, but I think, really all of the ministries address it as well, right? I mean, it's not, even when we look at education, that we don't try to sort of say these are kind of skill sets that boys need to have and these are skill sets that girls need to have, right? And so when we look at innovation, when we look at coding, we look at those sorts of things, so we make sure that girls and young women are participating in those as well. Really want to make sure that girls and young women have a voice at the table.
But are we making progress in this area, or sometimes you see that we're actually, stepping backwards when it comes to ensuring gender equality, or, I don't know. I
think we have a lot of inspiration here, Desi. I think you're one of them. For example, the fact that you're here. I think that two of the most powerful ministries are headed up by women.
Not enough, we can have more.
Yeah, no, exactly. But it's not just those. But I think, finance and foreign affairs are very, very powerful ministries. But we also have various other ministries that are also headed up by women. So for me, I think, there's still room there, but there's room in a lot of places. And my country, for the U.S., is one we have yet to elect a woman as president of our country. So I think that there are good examples here. We continue to focus on that. It's an important thread across all of our areas, and we know that we will not achieve results for children if we do not address the rights of girls as well.
Okay, good to hear. Now, one of the things that it's not just because of COVID, but because of our increasing dependency on technology, gadgets, and all things internet, Wi-Fi now being one of the most basic needs of our existence. Now, mental health, particularly amongst young people, is an increasingly important issue to focus on, as the numbers of children with mental health issues, depressions, even suicides, and also because of the gadget addiction, plus of course the kind of negative and toxic exposure they get from being on social media, the bullying and so on. Is this something that UNICEF is also looking at, in the future as one of the fundamental issues that children face?
It is, and it's one of our, we have 4 global priorities, advocacy priorities, and mental health is one of them. I was just actually at a regional meeting in Bangkok about a week and a half ago, and really looking at examples from different UNICEF country offices in terms of how they're addressing this. It's an issue that's been raised by young people. I had spoken to you about Mitra Muda earlier. This is one of the areas that they've really talked about. And I think one of the pieces that is concerning is the fragility of mental health. And it's not something that kind of deteriorates slowly, but where you can have a child that is fully well-adjusted 1 year and then 6 months or 12 months later.
Resilience, the word keeps being used. How do we create resilient children in face of all these challenges, enormous challenges, the sort of challenges we didn't, or at least I didn't face when I was a child. You just go out and play, and but now they're exposed to all sorts of things that.
I think it's exactly what you said, Desi. I mean, I think, and when you talk about going out to play, it means doing that with other kids. And so there's that socialization, there's that other activities, that there's not basically, your life is not defined by one single activity, and often which might be technologically based, but you have various different areas in which some areas you may do better, other areas you may do a little bit less. You interact, you learn how to adjust to other people. And that is a process of building resilience. And
but what kind of help would they, you mentioned the Mitra Muda, but what kind of help should there be in the system when it comes to, because these are real problems?
Well, an initiative that actually started here under the Ministry of Social Affairs, and which UNICEF is supporting about 1.5 years ago, is to really look at how we can decentralize and strengthen the social worker workforce. And often mental health services were really mostly accessible in capital cities or big areas, right? And kind of
where they have the expertise and also the
but they're things that people can be trained on. They're in terms of, if you can have social workers that are available at a subnational level, have them trained in identifying some key issues that may be triggers or suggestive that there may be some problems coming up later on. They can be identified before the problems become more severe and significant and addressed. Some of them are issues because of bullying. Bullying has become a big priority, and the Ministry of Education, to their credit, has really moved that forward. Exactly.
Devastating effects, absolutely.
So it is a significant concern. It's again, I've heard about cases all over the world where children who were very well adjusted have really fallen into difficult times. But I'm very happy that the government of Indonesia is taking this seriously, that they're addressing bullying, that they are involving young people in identifying what are some of the causes of mental distress, and that they are bringing services to a subnational level to address those more quickly.
Okay, well, our time's up, but just very quickly on issues of the rights of the child, and of course this is also a message for parents. Children do have rights, and maybe some parents don't know that. Cases of child abuse is also, we see, something that's concerning. Just very quickly, it's just something that UNICEF is also
we do.
Quite concerned about.
It is. In terms of abuse, neglect, these are all areas of violence against children. Violence against children can be happening in various different circumstances, and often through technological means as well. So this is something that we take very seriously. We try to address it through social media, but also to identify key stakeholders, those who work with children frequently, to be able to identify and address them quickly.
Okay, Robert. Quickly, 3.5 years in Indonesia. Any thoughts? Any impressions so far? And what would be your message for the National Children's Day in July?
Well, one is that I think that that it's great to see the increasing participation of young people. Indonesia actually ranks as one of the countries with the highest levels of optimism among young people. I think young people are confident about their future, but they really want to be involved in their future and to be decision makers, and not just be sitting at the table, but helping and making decisions. And I think I see a prosperous and hopeful future for Indonesia's youth.
And we should listen to them.
We should.
And even learn from them.
We should.
Okay, Robert, once again, thank you very much for your insight.
Thank you, Desi, for this opportunity.
Ya, demikian Insight with Desi Anwar kali ini. Jangan lupa Anda juga dapat menyaksikan tayangan ini di cnnindonesia.com dan di YouTube CNN Indonesia. Insight with Desi Anwar. Jangan lupa masih ada pandemi, sehingga harus jaga protokol kesehatan, jaga jarak, rajin cuci tangan, pakai masker, dan tentu saja hindari kerumunan kalau bisa. Sampai jumpa, stay safe. Bye-bye.